How is pyrazinamide dosage adjusted for renal or hepatic impairment? When treating tuberculosis, understanding how to adjust pyrazinamide doses in patients with kidney or liver problems is crucial. Pyrazinamide is mainly eliminated through the kidneys, so its dosing must be carefully managed in people with renal impairment. If a patient has a creatinine clearance above 30 milliliters per minute, the usual dose of 20 milligrams per kilogram daily can usually be given safely without adjustment. But if the kidney function drops below that level, especially in severe cases or kidney failure, the dosing needs to change. For those with very low kidney function, the dose is typically reduced to 25 to 35 milligrams per kilogram, given 3 times a week instead of daily. This extended interval helps prevent the drug from building up to toxic levels because the body clears it more slowly. For patients on dialysis, the dosing depends on the type of dialysis. With intermittent hemodialysis, a dose of 20 milligrams per kilogram is given once, then repeated after dialysis. For continuous dialysis, the usual daily dose can often be maintained. Moving to the liver, pyrazinamide is generally not recommended for patients with severe liver impairment because it can cause hepatotoxicity. Patients with existing liver disease are at higher risk for adverse effects, so doctors closely monitor liver function during treatment. In the context of tuberculosis therapy, pyrazinamide is used during the initial intensive phase, usually 4 to months, along with other drugs like isoniazid, rifampicin, and ethambutol. Since isoniazid and rifampicin are eliminated through the bile, their doses usually do not need adjustment in kidney problems. For patients with renal failure, the treatment plan might include extended dosing intervals for pyrazinamide and ethambutol, with careful monitoring for side effects such as nerve damage, gout, or liver issues. Patients with severe renal impairment should also receive pyridoxine or vitamin B6 to help prevent nerve problems. Overall, dose adjustments are based on how well the kidneys or liver are functioning, and it's always best to follow guidance from infectious disease specialists or tuberculosis treatment centers. They can tailor the treatment to each person's unique health situation, ensuring safety and effectiveness. Remember, always consult your healthcare provider for personalized advice, especially when dealing with complex conditions like kidney or liver disease.